Hello there, everyone. My name is Benjamin Varughese, and I am a second-year pre-medical studies major at Jefferson University in Philadelphia, Pennsylvania. Today, I will be discussing the topic of systemic racism in healthcare within the United States. So let's get started. Racial movements such as the Black Lives Matter movement have brought much-needed attention to systemic racism present in the United States. Racism describes the marginalization or oppression of individuals because of their race. Systemic racism describes this marginalization that is encouraged by institutions such as education and healthcare. To diminish the presence of racism within society, racist behaviors and practices must be studied within every field of society. Therefore, this presentation specifically focuses on the question of how does varying treatment among different racial groups constitute racism and discrimination within healthcare. Additionally, this presentation will discuss policies on how to diminish the influence of race within healthcare. For this project, my procedure to gather research included analyzing and assessing 13 scholarly papers that discuss racist behaviors, treatment discrepancies, and varying health statistics with specific regards to the treatment of COVID-19 and cancer in African Americans and Hispanic Americans. The results section encompasses 3 subheadings. These subheadings are evidence of discriminatory practices, varying health, and solutions. First, there is a large amount of evidence that discriminatory practices are still in effect within healthcare. For example, significant disparities between white Americans, African Americans, and Hispanic Americans are reflected in drug treatments being used, the behavior and bias of healthcare professionals, and the representation of racial minorities in clinical studies. Additionally, recent studies identified racial bias in healthcare algorithms, resulting in Black people being less likely to be eligible for intensive care management and less likely to receive timely diagnosis or appropriate care for heart failure, kidney disease, cancer, and more. Furthermore, 2016 studies showed that 40% of white medical students and 25% of white residents believed Black people have thicker skin than white people and that Black people's nerve endings are less sensitive than white people's. This perspective is factually inaccurate because race is simply a sociological construct. Genetically, Black individuals and white individuals are 99.9% identical, according to the Human Genome Project. The next part of the results section is my findings with regards to health disparities between African Americans, Hispanic Americans, and white Americans. With regards to cancer, African Americans face higher death rates than white Americans. Furthermore, African American women are about twice more likely to die of breast cancer than white women. In addition, African Americans and Hispanic Americans experience a heavier burden when it comes to infection and mortality rate. Figure 1 shows how racial minorities are more affected by COVID than white communities. These disparities between racial communities are also affected by other social determinants of health. However, there are still solutions that can help address these practices and disparities. For example, as seen in Figure 2, the trust between healthcare professionals and patients is extremely important. Therefore, to improve these relationships, healthcare professionals can embed more relationship-centered behaviors, such as exploring patients' perspectives with open-ended questions, asking for their input on decisions, listening respectfully, and more. Additionally, increasing the number of training courses in race in healthcare and the number of tests regarding race can also help. Also, employing a race implicit association test may also be a preferred solution. Other solutions include increasing participation of racial minorities within clinical trials, tracking of physicians' treatment of patients with regard to race, and more. Overall, there is significant evidence that racial disparities are present in healthcare. The differences in quality care, representation in clinical studies, and more harm racial minorities. Furthermore, this difference in treatment could lead to differences in health within racial minorities, especially with regards to COVID and cancer. Therefore, future directions/implications could help individuals raise awareness of this problem and formulate solutions and policies that encourage better practices and thereby a fairer system. I would like to take the time to acknowledge my faculty advisors, Dr. Amrit Munzik here, Dr. McCoy Day, and Ms. Kamira Bushneva. Thank you for listening.